When you think about mental health treatment, especially for really tough conditions like major depression, the story's always been about meds and talk therapy, right?
Right. And that often felt like, well, like guesswork for a lot of people.
Exactly, like throwing darts in the dark, a cycle of trying this drug, then that one. It could be really difficult.
Demoralizing, even.
But things are changing. Psychiatry's in a whole new phase now.
A revolutionary one, you could say.
We're moving past that guesswork. Today, we're diving into why transcranial magnetic stimulation, or TMS, why it's not just seen as some fancy niche equipment anymore. The consensus is building. Our sources show it's really being recognized now as a standard of psychiatric care.
A foundational part of treatment.
We want to give you the roadmap for understanding this huge shift. It's all about precision, measurable data, and relief that actually lasts.
Sustainable relief, yeah.
And just before we jump into the science, the nuts and bolts, we do want to mention that this look at cutting-edge mental health care is brought to you by Sabres Medical at blossomtms.com.
Okay, so our mission today, let's clarify what standard of care really means.
Good point. What does it actually signify?
It's more than just a suggestion. It's like a clinical mandate. It means the science behind TMS, how it works, the data, the fact that it's repeatable, it's solid, foundational.
Okay.
So we're going to unpack the hard evidence that pushed TMS to the forefront, moving us away from that old trial and error model.
Towards something more guided.
Exactly. Guided, precise science.
Okay, let's unpack the historical problem first. I think that context is really important for understanding why TMS is such a big deal now.
Agreed.
For decades, like we said, it was mostly systemic medication. And look, those treatments are vital. They help many people.
Absolutely. We're not discounting them.
But the sources definitely paint this picture where, a lot of patients, especially those with treatment-resistant depression, they were just left searching, looking for something that felt more restorative, something sustainable.
That right there, the inability to provide lasting relief for everyone that was the weak spot in the old model.
An efficacy ceiling, you could say.
Exactly. We hit a ceiling. For patients with major depressive disorder, MDD, who didn't respond well to the first or second medication, the chances of reaching sustained remission, well, they dropped off quite dramatically.
So it was more managing symptoms chemically.
Pretty much, rather than actually, restructuring or helping the brain's function itself.
Okay, so if the old way hit that ceiling, what does this standard of care label actually mean in the clinic? Is it just a regulatory thing, or?
It's kind of both, actually. To reach that level, a treatment needs to show it's effective, yes, but also safe.
Safe and reliable.
And repeatable across different clinics, different settings. Integrity is key. TMS earned this because it delivers those measurable long-term outcomes, especially, and this is crucial, in cases where medications didn't work.
And it's FDA cleared now.
Yes, for both depression and OCD. Obsessive-compulsive disorder.
Wow, OCD too.
And beyond that, clinicians are seeing really strong data for things like anxiety, even PTSD.
So have broad potential.
That wider applicability is definitely a huge factor in why it's becoming such a foundational tool.
That measurable data point feels really important. We all hear about the side effects from traditional meds, the fatigue, weight gain, sexual side effects.
Yeah, those are major issues for compliance.
People sometimes stop treatment because of them, right? Even if the drug is helping a bit.
Exactly. It's a real problem.
So is the effectiveness of TMS like the main driver here?
Yeah.
Or is it that combination, it works well and it avoids those side effects?
It's definitely the combination, but the efficacy numbers alone are compelling. Think about treatment-resistant depression. That's the really tough group.
The ones who haven't responded before.
Right. With traditional methods, maybe you'd see a sustained remission rate around, say, 30–40% after a year. Maybe.
Okay.
Sources show that precise TMS, when done right, is getting sustained response and remission rates often over 50%, sometimes quite a bit higher.
In that same difficult-to-treat group.
Yes. That clear, measurable difference in long-term success. That's the core reason it's now considered a standard of care.
Okay, here's where it gets really interesting. That aha moment.
Yeah.
Medication, as you said, goes through the whole body, right? Indirectly affecting brain chemistry.
Systemic effect.
How does TMS actually do that direct targeting everyone talks about? Physically, how does it work?
Okay, so we shift from chemistry to physics here.
Okay.
The core mechanism is electromagnetic induction. You're not swallowing anything. Instead, we use a focused magnetic field generated by a coil placed right against the scalp.
Externally.
Yes, completely non-invasively. That magnetic pulse passes right through the skin and bone, totally harmlessly. But when it reaches the specific neural circuits underneath,
It does something there.
it induces a tiny electrical current, very localized.
Ah, so that's the stimulation part, that localized current.
That's the secret sauce, exactly. Unlike a pill that goes everywhere, this is precise, gentle stimulation aimed only at the target area.
What's the goal then? To wake up those circuits?
Essentially, yes. We're stimulating neurons that might be underactive in depression. It's like giving that specific part of the brain a targeted workout.
And which part is that usual? I've seen the term left dorsolateral prefrontal cortex. That's a mouthful.
Huh? Yes, the DLPFC for short.
DLPSC. Got it. What does that part do?
Think of it as the brain's executive control center. It manages things like planning, motivation, regulating emotions, attention.
Kind of important stuff.
Very important stuff. And in many people with depression, that DLPFC seems to be running on low battery. Or its communication with deeper mood centers like the limbic system is off.
Disconnected somehow.
Sort of, yeah. TMS acts like a targeted charger for that specific area. It helps restore those healthy communication pathways. We're actually promoting neuroplasticity, the brain's ability to rewire and strengthen connections.
That's fascinating. So you're rebuilding connections, not just altering chemicals.
Precisely. It's a structural approach.
Okay, that detail is critical. Now, talking about precision and stimulation, electricity. Some listeners might immediately think of older procedures, maybe more invasive ones.
Yeah.
What's the difference between TMS and something like ECT, electroconvulsive therapy?
Ah, yes. A very, very important distinction. Cannot stress this enough.
Yep.
TMS is completely different from ECT. ECT requires general anesthesia. It involves intentionally inducing a brief, controlled seizure. The goal is sort of a global reset of brain activity.
Right, I've heard that.
TMS, totally non-invasive. It's gentle. No anesthesia needed at all. The magnetic pulses are highly localized and controlled specifically to avoid causing seizures. Patients are awake, comfortable,
What do they do during the session?
often reading, watching TV, just relaxing. It's localized stimulation versus a brain-wide electrical event. Big difference.
Okay, that clarity really helps understand why it's more accepted now as a standard. Low risk, high precision. So let's link this mechanism back to what you called precision psychiatry. If the machine targets the DLPFC, how is the treatment actually personalized? Is it the same for everyone?
Great question. No, it's not just a one-size-fits-all zap. That's where the technology really elevates the process.
How so?
It's not just a device, it's more like a therapeutic feedback system. Advanced systems, like the Blossom TMS therapy system you hear about, they allow clinicians to gather clinical data and track progress continuously.
What kind of data?
Well, symptom reporting from the patient, of course, but crucially, also brain-based feedback. For instance, the first step is usually mapping the patient's motor threshold.
Motor threshold.
Yeah, it helps determine the precise energy level needed for that specific person's brain conductivity. Everyone's a bit different.
Ah, personalized intensity.
Exactly. And then as treatment goes on, the system tracks everything, the exact coil position, the energy delivered, how the patient is responding session to session. So if maybe progress seems a bit slow, the clinician has actual data, precise metrics.
To make adjustments.
Yes. They can tweak the protocol, maybe adjust the intensity slightly, refine the target coordinates, even change the pattern of the pulses. It shifts the clinician from just following a recipe to actively tailoring the care based on real-time feedback.
Measurable, adjustable, data-informed. That really does sound revolutionary for mental health care.
It is.
Okay, let's shift gears slightly. Segment 3. What does this mean practically for the person getting the treatment? If I'm the patient, what are the immediate tangible benefits? Why is this better for me?
Okay, the practical upsides are huge. They directly address those big problems with medication compliance and quality of life we talked about.
Like the side effects.
Exactly. We touched on them, but the difference needs emphasizing.
Imagine someone, trying to balance treating their depression but also needing to stay sharp for work or family.
Perfect example. With TMS, someone can literally come in for a session, often around 20 minutes or so.
20 minutes, that's quick.
Yeah, pretty quick. They can do it on a lunch break, for instance, and then go right back to their day, work, errands, whatever.
No downtime.
No downtime. It's non-invasive, remember. No anesthesia, no recovery period needed.
Okay, that's a big one.
But maybe the biggest advantage, the one people really notice, is freedom from those systemic side effects. TMS doesn't cause the fatigue that makes it hard to function. It doesn't cause the sexual dysfunction or the weight gain that are so common with antidepressants.
Wow. That alone is huge.
It changes the whole conversation. It's not just about, is the treatment working? It's about, am I getting my whole life back? Restoring holistic quality of life.
And the outcomes back this up, right? The research shows real symptom reduction.
Significant reduction, yes. Even in those patients who'd failed multiple medications before.
The treatment-resistant group again.
Exactly. And importantly, that relief often lasts long after the initial course of treatment is finished.
So it's not just a temporary fix. People are getting better and staying better.
That's the goal, sustainable remission. And, that brings us back to the technology's role in maintaining this standard. It's not just about having a skilled clinician, though that's vital. You need consistent tools, too.
You absolutely need consistent, reliable tools. The sources mention systems like the Blossom TMS therapy system from Sabres Medical specifically. These aren't just pieces of hardware. They're engineered as precision delivery platforms.
What does that mean in practice?
It means they ensure that high level of repeatability and precision needed to actually meet the standard of care. Think about it. The clinician needs to know that the exact spot and the exact magnetic intensity they carefully determined in the first session
Needs to be hit just right every time.
every single time. Session 30 needs to be just as precise as session 1, no matter who is operating the system that day. That consistency is how you ensure those better outcomes, clinic to clinic, across the country.
That makes sense. That technological consistency, it really elevates it from just being advanced equipment to being part of a whole philosophy of care, right? Based on integrity, data, innovation.
Well said. The system itself helps protect the quality of care the patient receives. So what does this all mean? Let's try and synthesize this. The big takeaway seems to be that the new standard in psychiatric care is shifting, moving away from just managing symptoms chemically
Right.
towards actually rebuilding neural function structurally.
Using the brain's own ability to adapt neuroplasticity.
And this whole movement prioritizes data, precision, and getting relief that's measurable, sustainable. And it's all grounded squarely in brain science, not guesswork.
Absolutely.
This kind of personalized, non-invasive approach, it feels like it's truly redefining what effective treatment looks like right now.
It's powerful because it directly tackles that huge challenge of treatment-resistant depression, which was for so long a major hurdle. By moving from that trial-and-error chemistry to targeted data-driven physics, essentially, we're finally seeing the kind of sustainable improvement in people's lives that the field has been striving for decades.
Okay, so final thought here. Since this whole movement, precision targeting, data-informed protocols, is changing mental health care, what else could it impact? Thinking bigger picture. Could this neuroscience-based approach, focusing on specific neural circuits, could it help with other complex conditions? Maybe things like chronic pain or tinnitus, conditions that also rely on these subtle circuit adjustments.
That's a fascinating question and definitely where research is heading. The potential is there.
Gives you a lot to think about for the future of medicine, doesn't it?
It really does. And, if you're interested in being part of this shift, if you want to learn more about how this is redefining effective mental health treatment, you can discover how the Blossom TMS therapy system is helping clinics across the nation elevate patient outcomes. It's making a real difference.